Hello, and thank you for allowing me to present our work entitled Predicting the Return of Bladder Function Following Vaginal Native Tissue Repair Using Data from a Suprapubic Catheter Regimen. Here are relevant financial disclosures. Postoperative urinary retention following prolapse repair is common. Estimates are wide-ranging, but approach 70% in patients who have had a multi-compartment vaginal native tissue reconstruction and have a same-day voiding trial. The ideal timing of repeat voiding trial is unclear. The aims of this study were to evaluate the time to return of normal voiding function following native tissue vaginal reconstructive surgery and evaluate risk factors for prolonged postoperative urinary retention. This was a retrospective chart review examining patients who had undergone native tissue vaginal reconstruction with standard suprapubic catheter placement. All patients followed a suprapubic catheter regimen. Surrogate marker for return of bladder function was decided to be PVR less than 150 cc's at 4 hours, measured by suprapubic catheter. The primary outcome was time to PVR of less than 150 cc's at 4 hours. We examined 148 charts and included 126 women in the analysis. You can see here the characteristics of our cohort. The majority of patients had advanced stage prolapse, stage 3 or 4, had had a prior hysterectomy, and about half of our patients had a concomitant incontinence procedure. Here are the results from our univariate analysis, with significant variables highlighted in purple. The surgery length value was calculated for every 10-minute increase in surgical time and was found to be highly significant for delayed return of bladder function after day 4. Here are the results of our multivariate analysis. When controlling for other factors, diabetes and our surgery length value remain significant. Here is a graphical representation of cumulative patients voiding per postoperative day, with vault suspension patients in blue and hysterectomy patients in green. As you can see, 80% of vault suspension patients were able to void by day 5, whereas 80% of hysterectomy patients were not able to void until day 7. Based on this data, we would like to give you the following clinical recommendations. For patients who fail an initial voiding trial and cannot perform clean intermittent catheterization, we recommend removal of catheter at day 5 in patients who have had a vault suspension, and in day 7 in patients who have had a hysterectomy with concomitant repairs, have diabetes, or have had a prolonged surgery. We hope that this enables you to streamline your postoperative care and minimize office visits for failed voiding trials. Thank you, and here are our references.